Hi, I'm Dr. David Matlock, and I am the pioneer of laser vaginal rejuvenation. Today, we're going to go over some of the most frequently asked questions. What is laser vaginal rejuvenation, aka LVR? Laser vaginal rejuvenation is actually a surgical procedure whereby we use the laser to do all the cutting and dissecting, and we reconstruct and rejuvenate the upper part of the vagina, the bottom, and outside. How does laser vaginal rejuvenation work? Laser vaginal rejuvenation works by first reconstructing the upper part of the vagina, the bottom part of the vagina, and outside. Basically, what we are doing, we are bringing the muscles back together, top, bottom, and outside. Because in the vaginal rejuvenation procedure, what we find that the muscles are relaxed and pulled apart. If you think of the muscles of the right side of the body and left side of the body, top, bottom, and outside, these muscles, which should be nice, tight together, are actually pulled apart. That's causing the relaxation and the prolapse of the bladder, urethra, rectum herniating up. What issues or what concerns does laser vaginal rejuvenation address? Laser vaginal rejuvenation can address multiple areas as a result of vaginal relaxation. One big thing that women come in for is because of the fact that they have stress urinary incontinence. When they laugh, cough, strain, or exercise, they can lose urine, and this is socially embarrassing and hygienically unacceptable. So laser vaginal rejuvenation can correct that. It can also correct a bulge of the rectum up into the vagina. That's called a rectal seal. So it can reconstruct this and actually take care of that problem of the rectal seal. And also with patients, note that they have the perineum, the area immediately outside the vagina and above the anus, relaxed as well, and so that there's no support about the perineum, and it can correct that as well. Is the procedure painful, and is anesthesia used? In the procedure, 98% of patients want to have general. It's a very light and safe general anesthesia. Also, the patients get what we call a pudendal block for post-operative pain control anesthesia. When you go to the dentist and you get an injection, that's a nerve block. We do the same thing by the cervix, and it gives you post-operative pain relief for 18 to 24 hours. How many sessions of laser vaginal rejuvenation are required? Normally, you only need one session of laser vaginal rejuvenation. It's one and done. What's the difference between laser vaginal rejuvenation and non-surgical vaginal rejuvenation? I think it's really important to understand the difference between a non-surgical vaginal rejuvenation and a surgical vaginal rejuvenation. A surgical vaginal rejuvenation is actually real surgery with cutting and dissecting and suturing muscles back together, top, bottom, and outside. The non-invasive are using various different modalities to non-invasively treat the mucosa and some of the deeper tissues internally. That's the difference. And the thing is, I think if you look at this non-surgical treatment as an end-all and be-all, then you're going to end up with insufficient results. What is the recovery process like after laser vaginal rejuvenation? The recovery process after laser vaginal rejuvenation is relatively simple, meaning that you don't feel anything for the first 18 to 24 hours as a result of the pain block. After that, you will note discomfort primarily in the perineal body, the area immediately outside the vagina and above the anus. Pain medications can take care of this, as well as rectal suppositories that are just plain lidocaine can take care of that discomfort. Post-operatively, you can return to work in 7 days. We don't want you to do any exercise, yoga, spinning, cycling, Pilates for 6 weeks until you're completely healed and you can resume all your normal physical activities. Sexual activity is the same, not until 6 weeks. Can laser vaginal rejuvenation improve sexual gratification? Laser vaginal rejuvenation can improve sexual gratification if we understand sexual gratification is directly related to the amount of frictional forces generated. So if the vagina is too large and relaxed, and with laser vaginal rejuvenation, we can tighten top, bottom, outside, decrease the internal diameter, external diameter, and build up the perineal body. Thereby, by doing this, we can enhanced sexual gratification. Are there any risks or complications associated with laser vaginal rejuvenation? Like any surgery, there are risks. But laser vaginal rejuvenation is a relatively safe procedure. The risk and complications, the main things are bleeding and infection. The incidence of that is less than 1%. We want all patients to be 100% informed. We will give you a written list of risk and complications, other things to consider. They're self-explanatory. You have questions, please ask. Who is a suitable candidate for laser vaginal rejuvenation? A suitable candidate for laser vaginal rejuvenation is a woman who has had children, or she notices vaginal relaxation, decreased sexual gratification. She has problems with stress urinary incontinence as well. These people are good candidates for laser vaginal rejuvenation. How long do the effects of laser vaginal rejuvenation last? The effects of laser vaginal rejuvenation can last a lifetime. What caused the problem? Children. No problem. No other surgery will be needed. Can laser vaginal rejuvenation help with urinary incontinence? Laser vaginal rejuvenation can help with urinary incontinence, and this is one of the main reasons for laser vaginal rejuvenation. It can be as effective as 96% in stopping problems of stress urinary incontinence. Can laser vaginal rejuvenation rejuvenate the vagina to a pre-birth status? Laser vaginal rejuvenation actually can rejuvenate the vagina to a pre-birth status, and this is what a lot of women want. Is there an ideal age for undergoing laser vaginal rejuvenation? The ideal age for undergoing laser vaginal rejuvenation are those women who are in the childbearing age group. What should I expect during laser vaginal rejuvenation treatment? During laser vaginal rejuvenation treatment, first you will be in the recovery room. The nurse will see you, the anesthesiologist will see you, and I will see you. After everything's all done, vitals and so forth and everything, the anesthesiologist will give you a sedative. We want you nice and calm as you're being transitioned to the operating room. In the operating room, you'll be transitioned from the gurney to the operating table. And then the nurse is going to apply all of the monitors for the vital signs. And then the anesthesiologist will start giving you some medication for you to drift off. Then after you're completely asleep, we will completely prep the body, the area for the surgical procedure, myself and the scrub tech and the nurse. The body will be prepped. After that, we will start the procedure. The nurse will assist me, the surgical assistant will pass all the instruments and so forth, and this is how I do the procedure. After the procedure is complete, the anesthesiologist will wake you up, you move back to the gurney, and then we will transition you to the recovery room where you will recover for an hour and a half to 2 hours. And then you'll be able to go home. You have to go home with an adult. How soon after childbirth can I have laser vaginal rejuvenation? Well, if you've had a vaginal delivery, we say you can have laser vaginal rejuvenation at 6 weeks. At 6 weeks, the body is completely healed and all of the changes from pregnancy are reversed. If you had a C-section, we would like the woman to wait for 3 months prior to having the procedure. Also, if you were breastfeeding, we would like for you to wait until breastfeeding is over. Can laser vaginal rejuvenation be combined with other procedures? Laser vaginal rejuvenation can be combined with other procedures, and a lot of times women want them combined with other procedures such as liposuction, a corporate butt or Brazilian butt lift, tummy tucks, breast lift, breast reductions, or a mommy makeover. Are the results of laser vaginal rejuvenation natural looking? Laser vaginal rejuvenation in the actual technique is to rejuvenate the vulvar structures as well. So basically we want to see we don't want the introitus gaping apart. We want to see the introitus looking slit-like. We want to see the labia minora, the small inner lips coming back together in the midline at the bottom, and the labia majora coming back in the midline and build up the perineal body. How does laser vaginal rejuvenation compare to non-surgical options? I feel that you have to understand that there is a place for everything. Surgical options, such as laser vaginal rejuvenation, can encompass everything and take care of everything, as opposed to non-surgical. It's when someone pushes a non-surgical procedure, indicating that it can encompass everything and treat everything. That's not true, it can't. So if you use it properly, for the proper use, and don't oversell it, I should say, then it's fine. What kind of post-procedure care is necessary after laser vaginal rejuvenation. So postoperatively, what we want the patient to do is care for the area with normal soap and water, just a mild soap and water in the area. No tub baths, no jacuzzis, no ocean or anything like that. No feminine sprays or anything. If the period comes on, we only want you to use a pad. We don't want you using tight jeans or thong underwear or anything like that. So be cognizant of what has happened and what's going on and how to care for the area. So just nice, gentle care of the area. Is there any discomfort after laser vaginal rejuvenation? The primary discomfort after laser vaginal rejuvenation, what patients complain about, is the perineum. All the discomfort is 100% in the perineum, and the discomfort that patients note after laser vaginal rejuvenation is right in the perineum. That's the area right outside the vagina, at the bottom and above the anus. That's the perineum. That's the area basically where the obstetrician and gynecologist does a cut. There, that's exactly how it feels, like that cut, and that cut healing. What women say, what it feels like is the episiotomy that the obstetrician did at her delivery to give the area more space for the baby to come through. That's exactly how it feels like, 100%. How can I choose an experienced provider for laser vaginal rejuvenation? Well, first of all, what you need to do is do your homework. If you had a girlfriend who has had the procedure, you can get a recommendation from them, or you really have to do your homework and research or talk to your primary care physician to see if he or she has someone to refer you to. But research, internet, so forth, everything. Do your research and make a wise decision. You may have to do multiple consults until you're comfortable with someone that you trust to do the procedure for you. I would say you do want to have, say, a trained gynecologist who specializes in female genital plastic surgery. How soon can I expect to see results after undergoing laser vaginal rejuvenation? You can expect to see results completely after you're completely healed in 6 weeks. Are there any specific lifestyle changes that I need to do prior to laser vaginal rejuvenation? The most important thing to do is just to make sure that you're not on your cycle prior to coming in to have this procedure. Can laser vaginal rejuvenation help improve vaginal laxity after childbirth or aging? Laser vaginal rejuvenation absolutely can improve vaginal laxity after childbirth, especially, and also with aging as well. Will I need to take time off of work or other activities after laser vaginal rejuvenation? You will need to take time off of work after laser vaginal rejuvenation, especially depending upon the type of work that you do, and your provider can help you to make that determination. If you have a more physical job, yes, you may. If you have an office job, oh, you can go back to work in a week. Can laser vaginal rejuvenation make you have more orgasms? It's important to understand that the purpose of laser vaginal rejuvenation is the enhancement of sexual gratification. We cannot say that it's going to increase orgasms or make orgasms easier or more frequent. The purpose of the procedure is to enhance sexual gratification. Now, by doing that, if those things are more prevalent or more frequent or more intense, then fine. What kind of maintenance or follow-up treatments are recommended? After having laser vaginal rejuvenation, there is no further treatments necessary. And what do I mean by that? You have to look at the cause of the vaginal rejuvenation, which, like most women, is as a result of having children. So what caused the problem? Children. Therefore, no children, no problem. It's for life.